Hello, my name is Pauline RN. We are continuing with mobility part 2. Please note these are questions and answers from RN Nclex examination. Please hit the thumbs up. Please subscribe with that black button. And please share this video with your friends, families, classmates. My first question. Your patient is experiencing syncope while ambulating. What does the nurse do? The correct answer, lower your patient gently on the floor to prevent fall. Next question. One principle of ROM, range of motion exercise, is to do what is the question. The correct answer, ROM exercises provide support of distal joints is the correct answer. My next question, what do you know about intensity activities? The correct answer, it needs to be done more often. For value is the correct answer. We're trying to do a care plan for a patient with activity intolerance. What would you include is the question. For patients, care plan, activity intolerance. One consult would be for a physical therapist to see your patient, occupational therapist, social worker, include family, consider patient's activity, increase patient's activity level gradually. These are all your care plans is the correct answer. What would be your intervention for a foot drop? The correct answer, use your footboard. 1, 2. You can use a sneakers or a tennis shoes is the correct answer. Next question. What is your intervention for patient with scoliosis? Correct answer is do ROM exercises, range of motion exercises. Scoliosis is diagnosed for patients who has curvature of the spine. Next question, what is lordosis? Correct answer, abnormal anterior curvature of the lumbar spine is the correct answer. Next question, define urinary stasis. Correct answer, urinary accumulation leading to UTI. Turn and reposition your patients every 2 hours. Urine should be at least 30 cc's an hour. Less than 30 cc, notify your doctor. Urinary stasis are found in elderly patients, so you have to immobile patients. Turn and reposition them. Urinary stasis, check post-op patients for risk of hemorrhaging. Patients with abdominal surgery, make sure they're avoiding greater than 30 cc's an hour. Patients can be having urinary stasis post-operatively and they are at risk for hemorrhaging. So check those Foley catheters they are coming from surgery with. You have to notify the doctors. We do not want them to have urinary stasis. We do not want them to have hemorrhages from their new surgical wound because that would risk them maybe to return to surgery. Next question, what is base of support? Correct answer, balance or stability provided by feet and their positioning is the correct answer. Next question, what is log rolling? Log rolling is correct answer, maintain alignment of the spine while turning and rolling your patients. Next question, what is catabolism? Correct question is breakdown of more complex substances into simpler ones to release energy is catabolism. Next question, what is crepitus? Correct answer, crepitus is grating of ends of bones is the correct answer. Post-operatively, we have to assess our patient's Homan sign. We have to assess our patients who are having pain in their calves, their legs. Homan sign is assessment, especially your post-op patients. Pain in the calves of the legs upon dorsiflexion of the foot with the leg extended. That is diagnostic of thrombosis in the deep veins. This is our Homan signs assessment for our post-operative patient. Next question is, what is alkalosis? Alkalosis answers is permanent immobile joint. When lifting a patient, what is the nurse supposed to do? The correct answer, ask for help. Foot should be wide base of support when lifting a patient. Foot should be wide stance. Proper alignment is necessary when lifting a patient. Avoid bending and twisting. Keep object close when lifting a patient is the correct answers. When taking care of a patient in bed, what should the nurse do? Nurse should ask for help if needed. Nurse should raise the bed at the level of her height. Raise the bed, prevent back pain, back injuries for the nurses. Save your back. Push instead of lifting your patients when you're taking care of them in bed. When walking your patients and you find out that your patient is doing better, maybe than the day before, or maybe you're walking them in the evening and they're doing better than when you walk them in the morning, what should the nurse do? The correct answer is reward your patient. Let them know how well they are doing. Encourage them. Next question, why do we use overhead trapeze? We find a lot of these on the orthopedic floors. Correct answer, to help patients change position, moving from right to left, moving up and down in bed, helping patients to move from bed to change. Some patients have knee surgeries, hip surgeries. It allows them to move around in bed. Next question. For patients with osteoporosis. What causes patients with osteoporosis is at risk for what in the elderly? The correct answer is pathological fractures. Patients with osteoporosis, the elderly, is at risk for pathological fractures. They're at risk for falls. Teach patients calcium intake. Teach patients take calcium with vitamin D for absorption. Next question. What are the benefits of physical exercise? What are the benefits of physical exercise? The correct answer is to enhance cardiopulmonary musculoskeletal function is the correct answer. Client diagnosed with DVT. Client diagnosed. The client was experiencing all these symptoms. We notified the doctor, and the doctor sent them out for x-rays, Doppler of their lower extremities, and the test shows that they are positive for DVT. They are positive for thrombophlebitis. They are positive, as stated from the Doppler. What is the nurse's responsibility? Correct answer: do not massage patients' legs. Patients who are diagnosed with DVT, thrombophlebitis, blood clots, you do not massage their legs. You do not apply support hose to their legs. They have blood clots in their legs. The doctors will order blood thinners to relieve those clots. Heparin, IV, heparin drip. But the doctors will order us blood thinners to release these blood clots. Next question. What does CBR stands for? Complete bed rest is your correct answer. Next question. What is a diet for immobility? Correct answer is high protein, high vitamin B, high vitamin C. Next question. What are the interventions for your patients in restorative care? Restorative care are rehabs, nursing homes for the elderly. In rehab, restorative care, we assist them with their ADLs, their range of motion exercises, assisting with walkers, cane, crutches, walking. If the doctor orders physical therapy, occupational therapy, we'll make sure the patients are getting their exercises. Next question. What are your passive range of motion exercises intervention? The correct answer is stay close to the joint. To assist with exercises, use cupped hands under heels is the correct answer for passive ROM exercises. Next question. Give an example of isometric exercise. And the answer is yoga. Doctor's order is high Fowler position. How many degrees is that? The correct answer is 90 degrees. We will do these as ordered by the doctor when we're feeding them, when we're tube feeding them, to prevent aspiration, pneumonia. We have to elevate the head of the bed to prevent aspirations for these patients. Please hit the thumbs up button. Please hit the subscribe black button. Please share this video with your friends, relatives, and classmates. Please stay blessed. Thank you.